different options of breast reconstruction, and in general it's either using your own tissue or using an implant. If you were to use your own tissue, it would be taking flaps from either the belly area or else from the back. If it's those areas aren't possible, then your surgeon may talk to you about the possibility of using an implant to add the volume that you've lost. An example of an implant, they come in different sizes and shapes, and this in particular is what we call an anatomical implant. If you are considering the possibility of having breast reconstruction for yourself, then please talk to your friends, but also please talk to your GP, and in particular your breast care nurses.
My name is Claire Stock and I'm 50 years of age. I've got 2 children and a husband. Live in Swansea. I was actually diagnosed with breast cancer back in January 2011.
Okay.
Found a lump by accident. So my breast removed, followed by the lymph nodes coming out in the April. Carried on then, had chemo and radiotherapy, and actually had my reconstruction in December 2012. I had the ECFLA, which is the tummy tuck procedure, and I had that one only because I didn't have enough back flap. They cut tummy from there to that right across and took a wad of fat from there and popped it up there. So I'll have a tiny nip and tuck to make it fit into my bra, and then I'll have, and she'll create a new nipple for me, and then I'll have my one and only tattoo to finish it off.
My name's Karen, I'm 45, from Mumbles in Swansea. I'm married with 2 young boys, 8 and 10. I found a lump in my right breast as I was just sitting there. So I went to the doctor straight away the next day. I didn't believe for a minute that it would be cancer. I just thought it would be a cyst. And they did a scan and I could just see the change in their faces, and I just knew straight away, you know, by their body language. So I had a biopsy that day, and then 2 weeks later they confirmed it was cancer. Ms. Nguyen examined me, obviously, when I went to see her, and she felt that I was too slim to consider anything other really than an implant. There was no fat on my body, and also I had particularly thin skin as well. So implants were the only option for me, which I was more than happy with. And again, doing it immediately again was probably the best option. You know, I can't lie, it was painful, but certainly bearable under the circumstances. You know, the cancer was gone, and it was a new way forward. So it's not anything that I would sort of say, you know, was unbearable. Now I'm 7 months down the line now, and I feel perfectly normal. So yeah, fine.
My name is Bernadette. I'm from Llanelli. I'm 54. I'm actually a counsellor. I work for one of the cancer organisations, so see a lot of cancer patients through the course of my work. In 2011, following breast cancer myself, I had reconstruction known as an LD flap, which means basically a muscle was moved from my back. It was kind of tunnelled through the muscle and the skin to form a new breast. What I did find quite uncomfortable were the exercises following the procedure. Quite difficult because you had to fully stretch the arm right up and stretch through the whole area that had been operated on. Well, after 6 weeks I was back in work and I was fully functioning as I was before. Following that, there was a nipple created on the reconstructed breast, which was constructed out of breast tissue. So that was a massive thing actually, and I was quite surprised myself the impact that actually had psychologically. You know, it's before it was a mound and the nipple kind of turned it into a breast.